Hi there, Kyle. How are you today?
Well, not too bad for my Friday at work. You?
I'm doing well,
Good,
thank you. Thanks
good.
for taking the time to speak with us.
Absolutely.
You ready to answer some questions?
I don't know if they're going to be good answers, but yeah, yeah.
Okay, we'll see. Let's start with your name
I'm Kyle Vandenacre.
and what you do here at Benefis.
I'm a registered nurse in the emergency department.
How long have you been working in healthcare?
I did look at that one. I counted a year and 8 months, like to the day.
Oh, very specific.
Yeah, huh.
Have you completed any special training or programs along the way?
Um, they offer career growth kind of things, but they're also required in the emergency department. You take TNCC, ENPC, basic dysrhythmia classes, everything that they put you in a position to succeed. A lot of times we put them with ICU nurses, so that way when we call, we're kind of on the same page of what to expect or what we should be looking at when very sick patients are there.
What's the most unique part of your job?
Um, I really, what I think is unique is you get a patient, oftentimes sick patients, you don't know what they're here for because a lot of times they're unresponsive. And they're brought in by fire or GFES, and you kind of get to start at square one. And as you see, you piece the puzzle together, and you get to try different things and see those things work or, save lives is what they tell you. And I guess realistically, in some of them situations, that's what we get to do.
What kind of health topics do you think we should be talking about more?
Um, I think a lot of outpatient resources that we now have in healthcare, a lot of times people are just like, well, just go to your primary care. Well, there's other ways that we can benefit from that. And in the emergency department, a lot of people come in for things that they could probably take care of outpatient, but they come in and I guess it's a good way to give them resources. In my mind, I tell myself they're going to use them. Sometimes they're back the next day.
What's your favorite thing about your job?
Um, the people I work with. We have a very tight knit group. We really are a family. We love each other, but at the same time, we're like siblings, and sometimes we just need our space. And we're all good at understanding when those times are. Um, and the teamwork aspect of it is yesterday I worked mids, Tuesday, Wednesday, not night shift. And we had three traumas come in, and it was interesting to see how everyone kind of did their own thing in each pod to make those things work so patients didn't get lost in space and that we could actually help them when they needed it.
What do you like to do when you're not working?
I go home to Conrad and Farm. It's surprisingly a little less stressful than this, but I grew up on a farm and that's, I guess, someday what I plan on doing. So it's nice to get away from, I guess, being inside 12 hours a day, then sleeping the other 12, and then to go home and spend it all outside with my family.
Do you have a favorite snack or beverage that you get here at work?
Um, I mean, the PB&Js are a go-to, but I personally like the hot chocolate that we have down here. When it gets a little bit slow at 3 in the morning sometimes, I get hot chocolate and I put 2 packets in. I stir the first one, and the second one, I just let it sit and kind of pick at it and just eat the sugar.
Add some texture.
Yeah.
What's your favorite thing about working at Benefis?
Um, like I said, being close to home is definitely a benefit because I can just go home. I'm often used as a parts runner at this point because in Conrad sometimes we don't have those things. But also you get people from all over, which is interesting too. But you go to the same, not high school, but they're around the same area, so you know these kids. You know what they are, and you know like their families way before you even started working with them. So it's nice to get to know them on a personal level now that you're outside of sports or high school and or college.
Well, we really appreciate you taking the time to speak with us.
Yeah, I'm here a half hour early. Yeah. Yeah, no problem.
We appreciate it.
Yeah, you're welcome.